The South African Medical Association says it's happy now that vaccination booster shots are available. Last week, the Department of Health announced that from the 24th of December, Johnson & Johnson booster vaccinations will be available to those who received their initial J&J vaccines less than 2 months ago. The department further announced that Pfizer booster vaccinations will be available from Tuesday to those who received their final doses of Pfizer vaccines 6 or more months ago. To help us unpack this further, we are now joined by Dr Mvuyisi Mzukwa, who's the Vice Chairperson of the South African Medical Association. Dr Mzukwa, thank you so much for your time and thank you for joining us. It does seem that the national booster program is finally underway, and I'd imagine that these are certainly welcomed news for the association.
Good evening to you and to your viewers. Thanks for having us in your program. Yes, we welcome this good news for the country to finally have these booster shots, like we have been requesting all the time that they need to be considered. But we think we have a government that is listening. We also had that helping hand that comes from SABRA when they had undergone all the necessary checks and balances to make sure that what gets out there in the community is safe and can be used safely.
Certainly, Dr. Mzukwa, I think for a lot of South Africans who, of course, are perhaps willing to come on board with the booster program, some may be asking themselves, what is the need, what is the necessity for a booster shot? Many of them may be asking themselves, if I've already taken a vaccination dose, why do I need to go back for another dose, in some cases even a third one?
Well, the issue of booster doses is not a new phenomenon. It is a usual thing that happens in the medical fraternity. You remember that regarding the hepatitis vaccine, it is taken every 5 years. I also think that there's also the anti-tetanus vaccine as well that you get every 5 years, especially if you get injured. It's not a new phenomenon. Even with childhood, those schedules, in most of those are just boosters. So it is important that we notice that it's not a lifelong vaccination when you get a jab. It has to be at some point you should receive a booster because it tends to wane after a period of time, usually 6 to 8 months after the initial dose.
All right, Dr. Mzukwa, perhaps maybe just talk to us further, I suppose, about the clinical role that booster shots are playing during this COVID-19 pandemic.
Could you please come again?
I was saying, perhaps just talk to us a little bit more about the clinical role that booster shots will be playing during this COVID-19 pandemic.
Oh, thank you so much. No, it is important that we get those booster doses because, like I said initially, after a period of time, you find that the immunity that is initiated by vaccines tend to wane. So you do need a booster after a period of time. But on top of that, you want to target especially those who are vulnerable, people who are having underlying medical conditions, because they are, and the elderly, they are the ones that tend to populate the hospitals and the healthcare centers. So you want to protect them, but also you want to avoid any problems regarding the use of healthcare facilities, but also on the economy as well. Because if you have people who are unvaccinated, they tend to catch the virus easily, they may complicate, and that may have a negative impact in terms of the economy. So it will play a big role in terms of protecting not only our health, but also our livelihoods as well.
Now, Dr. Mzukwa, as a country, we are sort of miles behind other countries when it comes to booster programs specifically. When we compare ourselves to the US, to the UK and other European countries, we are far, really, from meeting our initial targets. Talk to us about the reasoning of starting a booster program when our initial national vaccination program is still lagging behind. I mean, quite a number of South Africans who've taken, for instance, their first Pfizer shots are yet to come back for their second, and already we're having conversations about a third Pfizer shot.
Well, even though we have a huge challenge when it comes to vaccination, but I do think that we have, made significant milestones when it comes to vaccinating the elderly, the people who are at risk. And I think also we've done a bit in terms of vaccinating the healthcare workers. I do think that it is going to help us, to be targeting those who are at high risk. To get a booster, I do think that if we're not to use those doses now, we might run a risk of having them, expiring. And we might have a problem because those will have to be taken down the drain, and we don't want to have such a thing. We have enough of those vaccines now, but if we don't use them, we are going to face a huge problem. So we might as well use the vaccines, in a productive way, that other than, waiting for people who might not even come for those vaccines, because that there's some hesitancy. Some people at times they don't even want to use the vaccines.
Yeah. Now that you've mentioned issues around potential surplus and issues around, a number of vaccines, if they're not being utilized right now the way that they should be, an issue around those vaccinations becoming obsolete, there is some global debate, Dr. Mzukwa, around the issue of booster programs. WHO Director General, for instance, Dr. Mvuyisi has been quoted saying that booster vaccine programs are likely to prolong the pandemic. Essentially, he's arguing that this sort of widespread distribution of boosters risk diverting supply away from countries that are still struggling to administer their initial jabs. What are your thoughts on that, on the general handling of vaccination distributions and booster programs worldwide?
Well, it is a huge problem, because you must remember, we've been dealing with what they call vaccine nationalism, where these rich countries are hoarding, vaccines for themselves, all the rich countries. And you find that there are, third world countries who have not had access to these vaccines, and they are lagging behind in terms of vaccination. You are likely to have a problem of variants coming in if you have people who are unvaccinated at this point in time, especially if they are in big numbers. But also, what do you do in countries where vaccines are there in numbers and people are not using them? Why can't you use those vials, to do something else that is still going to assist, the vulnerable within that country? I believe that each country has its own challenges, and South Africa as well has got its own challenges. We know it's not only communities that are having a problem of taking jabs. Also, the way that we have done it, in terms of our rollout program, we have excluded some and used some and delayed even in the process of having a rollout of vaccination. So there's many challenges, both from government and also from society as well, but more so from government, because government has not done enough to do education and promotion of these vaccines, to make sure that people do understand if they have concerns, those concerns are attended to, adequately, in a meaningful way, not just, being brushed aside and then in a few seconds and then you move on.
Certainly. Lastly, Dr. Mzukwa, before we let you go, just looking at some of the trends, our COVID-19 numbers, yesterday we recorded just over 5,600 new COVID-19 infections. The latest update putting out COVID numbers at 3,782 new cases, obviously marking some sort of a significant drop. What can you tell us about the trend that we're seeing? I mean, at some point we were hitting the high numbers in the 20,000s, for instance, and now we're looking at 3,000 or just over 3,700. What would you say is happening presently in the country when talking COVID-19 numbers?
Well, it is a very promising trend, considering the fact that we are in a festive season. And I would, take this credit and give it to South Africans, whom I think are doing their best, to socially distance. They are wearing their masks. I think we need to applaud that, and we need to encourage it. I didn't expect, honestly, on my side, to see such a promising trend at this point in time. So whatever we are doing on the ground, it means we are listening to each other, we are really concerned about each other, and we are doing something about it. And also, I'm sure that people they continue to vaccinate, because that is also assisting, these non-pharmaceutical interventions. So that's my take on it.
Certainly. Dr. Mzukwa, thank you so much for your time, and thank you for joining us. That was the Vice Chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa.